The first thing that comes to my mind is to see this community of hydrationists, as we like to say, this community of people that are a strong interest in hydration and its effects on health. The first reason why people are attending, it's beyond the place, it's beyond meeting people who have the same interest, is to learn the latest development around hydration science. And this is a major change versus 5 or 6 years ago, to see this science really moving forward like it has never been. To see this community coming back every year at the conference, and to see it growing also, and also getting more willingness to not only to learn about the science, but also how to use this science practically and research in educational programs, in public health campaigns.
Well, I think it's a very important conference. I'm actually so surprised that we know so little about hydration, which is such an important topic. Roughly, if you look at the recommendations of the EFSA or the various medical bodies, people do not drink enough water, do not drink enough liquids, especially children, and this is worrying because they're developing, and therefore we have to find ways of helping people to get their needs in what is a more and more hectic environment.
This conference is fantastic because there is hydration work and studies happening in various different fields, because water is involved in so many aspects of our health, and it's the one place where I can come and hear about water in all the different fields, and it's very, very, very exciting. Water is more or less related to everything, every aspect of our health, because it is our most important nutrient. It is how our body does things. So when nerves fire, it's water moving in and out of the cell. How we think, how we feel, how we taste, it impacts everything. So getting the hydration right takes us a long way towards good health.
There is increasing evidence that dehydration is more common than we think, and that it may have multiple effects on cognition, on your ability to think and to perform, on your muscle strength, muscle stamina, energy, on kidney function and kidney disease, even on liver function and other aspects. Looks like there's both short-term and long-term implications with recurrent dehydration. We don't really know what the perfect hydration drink should be. We do know that you probably do need some glucose and some sugar because it's very important for energy. But the problem is that if you drink something as sugary as a soft drink, it's too much sugar, there's too much fructose, and it seems to amplify the kidney damage. So picking your hydration drink is something we need to be careful about. And I do think water, in our studies, water protected the animals from dehydration-associated kidney disease, whereas sugary beverages made things worse.
The brain is like any other organ or muscle in our body, and most of us like to focus on muscles and bones, and we know quite simply that if you lift weights, your muscles grow bigger. If you ride a bike, your lungs grow stronger. And we've only recently really begun to understand that this is true of the brain as well. And our greater understanding of health behaviors, such as water consumption, is really important and timely. About 10 years ago, began the first neuroscience studies on brain structure and function in children. And we really know nothing outside of physical activity and its relationship to brain health. And so now that we're getting into other health behaviors such as obesity or diet and water consumption, these are very important, not just to understand the brain and how it functions with different behaviors, but it's also important to study this in children because we give them the opportunity to develop a healthy lifestyle, strong health behaviors, and the efficacy to grow those behaviors over the course of their lifespan. And so hopefully we don't just have healthy children, but we set up healthy adults through strong, effective functioning throughout the course of the lifespan. A big interest this year particularly is the
urine color chart and the kids' hydration habits, which is extremely important. And I'm very excited to be part of it and very happy to be able to present some new and exciting data regarding healthy hydration habits and useful practical tools that kids can use to measure hydration on their own. The urine color scale, it's a valid tool, and children do have the ability to self-assess their hydration state fairly accurate. So it's a very simple and very practical tool for every human being, and since hydration is something that can change dramatically from day to day, it is important to have inexpensive, simple and practical tools that I guess almost every day you can check your hydration state.
It was great to hear about children. You know, we're opening a new chapter really around that kind of science, and I'm looking forward to more results in the coming years. We have taken chronic kidney disease discussion to a next level. You know, we understand now much more about the mechanism and how water plays a role to prevent chronic kidney disease. So this was another really big part of the day. Then it was interesting to see on obesity how we can make changes in the behaviors of population, whether it's the women in Mexico or young children in Poland. So very exciting topic for us too, and absolutely and totally connected with Hydration for Health.